Some patients have anatomic changes within their nose that explain their migraine headaches.
Let me know how have things been since you had your surgery.
I mean, as we were discussing earlier, I think the surgery made an improvement in just the whole migraine cycle. I just think I went back to my old ways too soon after the surgery, just drinking caffeine and eating a lot of the foods that were triggers, and drinking the bourbon, and that's not good things. So I think that kind of brought the whole headache cycle back again.
Mm-hmm.
So I think once I removed those things out of my diet, as I have started doing this week,
yes,
I've seen a noticeable improvement.
Yeah.
But just aside from the migraines, when I came to you initially, I believe it was in October,
mm-hmm,
I had gotten to the point where I had a headache every single day. It was a low-grade migraine with nausea,
mm-hmm,
extreme sensitivity to light. By
mm-hmm,
December, I couldn't even drive in the evenings. It was just horrible. I was just reduced to tears by the light sensitivity and the nausea.
uh-huh.
And that I've seen, I'd say, an 80 to 90% improvement. I don't wake up with a headache every single day. I don't go to bed with a headache. So that has just significantly improved. That's a huge life change for me.
Yeah. Well, so your migraines were, as we've discussed, were due to intranasal pathology. So you had a deviated septum, and then on that right-hand side, you had that concha pilosa, which is like an air cell in the middle turbinate, mm-hmm, on the inside of the nose, and there was close contact between that turbinate and the septum. So, and if I recall correctly, your headaches were predominantly behind your right eye, in addition to other places, but the real significant location was behind your right eye. So you had a correlation between anatomy and your symptoms that was pretty close link. And then what's another interesting thing about your particular situation, and what distinguishes it from other types of migraine headaches, is that yours kind of had this baseline sort of gnawing migraine, and that makes sense because you had anatomy that wasn't fluctuating. You had this middle turbinate with a concha pilosa, which is the air cell. That doesn't really change. It's always there. And it had close contact with this deviated septum. Again, something else that doesn't change. And that's why yours, with this intranasal pathology, likely had this baseline constant pain, migraine pain, that was then punctuated by other migraines. So you may have other trigger points that we may, after we kind of get you to recover from this initial surgery, we may start to identify and work on those too. I don't think now is the right time, but I do think once you're healed and you're kind of like at a stable, we have a good understanding of what your rhythm is going to be, those may be addressed. But you're definitely a different type of patient than the type of patient who says that they have migraines that are here and go this way, or here and go this way. Those seem to be a little bit more episodic, because it's not like it is to some degree a constant trigger, but not to the same degree that an intranasal pathology is a constant trigger. So I'm glad to hear that at a baseline you're better, as we would kind of expect. You've had a couple of migraines since surgery, but overall, if I'm not putting words in your mouth, it seems like your life is better and seems to have a very positive trajectory. Another thing that's important to note is you're really not that far out from surgery. So our expectation is once inflammation reduces, once you normalize breathing through your nose, you're going to continue to have improvement as well.
Well, I'm glad you mentioned the right eye thing, because I don't have that constant pain, that boring pain behind my right eye anymore.
Yeah.
And when I do have the migraines, it's not behind my right eye.
Yeah. And those are things we're going to need to key on, and you're going to keep the log that you spoke of on a flow sheet, and that's going to be vital information for us to attempt. If you do have other trigger sites that can be treated by things that I do, that information, now that we've removed the sort of baseline pain, is going to come to the forefront, and we'll be able to deal with it appropriately.
Right. And I think also, too, now that you've removed that baseline, it allows the migraine medications that I have in my arsenal to work better.
You did tell me
which
that,
is key, because they had stopped working completely.
Yeah, you did mention that.
I had no options to treat my headaches at all at that point. Yeah. And I had been given steroid blocks. I'd gone through the gamut of the triptans. I was back on DHE45, which is an old school. I think it's an ergot medication that causes strokes, but it had gotten to that point we couldn't find a medication that would abort my headaches.
Yeah.
So it's amazing that at least I have tools I can use to stop those headaches, and they don't go on for days and days.
Yeah,
So.
yeah. We've taken you from being a patient with recalcitrant migraines to a patient who recalcitrant migraines and baseline sort of low-level migraines, as you said. We've taken you from that to a patient who has episodic yet treatable migraines.
Right.
And perhaps we'll get you to have an improvement beyond that. But even if that's all we've done for you, to me it seems, it's very gratifying for me, and it seems like it's an improvement in your life as well.
Oh my gosh, yeah. Yeah.
Excellent.
So many, yeah. I was out of PTO. I gotta tell you, I couldn't take any more time off work. So now I'm not incapacitated by headaches all the time.
This is the first time I've seen you smile.
Exactly. Second time.
Yeah.
But yeah, thank you so much.
You're welcome. All right. Well, we'll see you in 2 months.
Okay.